All district health boards are now operating vaccination clinics, and so the number of people being vaccinated is expected to increase substantially over coming weeks. As we expected, the numbers did dip over the Easter period, and as both vaccinators and people in Group 2, the estimated 480,000 frontline workers and healthcare workers and people living in high-risk settings did take a break. We anticipate DHBs will be ramping up from this point to around 35,000 people being vaccinated a week. The total number of doses administered as of midnight last night was 90,286, and we're expected to hit the 100,000 doses administered milestone in the next couple of days. From today, our key vaccination statistics will be available on the Ministry of Health website in a quite comprehensive dashboard. It will be updated for the time being every week on Wednesday. It provides a snapshot of progress, including the number of people receiving their first vaccination. That in the current iteration is 71,013. The number of people who have received their second vaccination and are therefore fully vaccinated, which is now 19,273. There will be a graph indicating the number of vaccinations administered each week versus the forecast numbers, and for this week that is now 96%. The dashboard will also have information on vaccines administered on a given day, the number of first and second doses administered by individual district health board, and vaccinations delivered by ethnicity. We are also reporting on adverse reactions following immunisation, and this afternoon MedSafe, as you know, our medicines regulator, will be publishing its initial report on the safety monitoring of the rollout of the Pfizer-BioNTech vaccine to date. It will cover adverse events following immunisation, and that will also be updated weekly. The latest figures in that regard up to the 6th of March, there have been 147 adverse reactions reported. I should say an adverse reaction is any reaction, whether it's mild or considered serious. Of those, there were 3 that were considered serious. Now, it's quite a low bar for serious. All these involved an allergic reaction of some kind, one of which was classified as an anaphylactic reaction to the vaccine in someone who had a history of allergies. All were managed appropriately on the spot. That's why we have nursing and medical oversight, and none of these people required hospitalisation or have any ongoing problems. There have been no new safety concerns with the vaccine identified here in New Zealand, and MedSafe's assessment is that the number and pattern of adverse events that are reported to date is very much in line with what they would expect and also what's been reported overseas.